She couldn't hear, but she could listen. In the silence of her own world, Helen Taussig heard the failing hearts of children and gave them a second chance. At a time when babies born with congenital heart defects were a death sentence, she dared to change the rhythm of medicine itself. This is the story of how one woman, in a white coat and against all odds, saved the lives no one else could. A girl with a stethoscope, early life and medical struggles. To save the heart of a child, sometimes you need a different kind of hearing. Helen Brooke Taussig was born in 1898 in Cambridge, Massachusetts, into a world that did not expect much from women, especially not in science or medicine. Her father, Frank W. Taussig, was a renowned economist and a Harvard professor. Her mother, Edith Thomas Guild, was a suffragist and advocate for women's education. But despite this intellectually stimulating home, Helen's early years were shadowed by profound challenges. At the age of 11, Helen lost her mother to tuberculosis, a blow that would echo throughout her life. Soon after, Helen herself contracted whooping cough, a disease that, while not fatal in her case, left her with a lifelong disability, near total hearing loss. Later in life, a condition known as otosclerosis would take what little hearing remained. In an era before hearing aids were widely available or effective, this was a devastating barrier, especially for someone who dreamed of a career in medicine. And Helen dreamed big. As a girl, she excelled academically, showing early promise in the sciences. But at every turn, the world reminded her what was expected of young women and what was not. When she applied to Harvard Medical School, she was flatly denied. Women were simply not admitted. The doors to the highest levels of education and research were closed, often locked behind polite language and firm tradition. Still, Helen persisted. She enrolled at Radcliffe College, the women's counterpart to Harvard, where she struggled through courses largely segregated from the male student body. She found it difficult to concentrate in large lecture halls where her limited hearing put her at a severe disadvantage. At one point, she resorted to hiring tutors just to keep up. Eventually, she transferred to the University of California, Berkeley, where she earned her undergraduate degree in 1921. But Helen wanted more than education. She wanted to be a doctor. Rejected by Harvard once again, she applied to Boston University's medical program, only to face the same obstacles. Finally, Johns Hopkins School of Medicine, a progressive institution by the standards of the time, accepted her into its class of 1923. Even then, she was one of only 4 women in a class of over 90. At Johns Hopkins, Helen began to blossom. There, she was mentored by 2 pioneering figures, Dr. Florence Sabin, one of the first female professors at the school and a celebrated anatomist, and Dr. William Welch, one of the founding physicians of the institution. Under their guidance, Taussig began to focus on pediatrics and internal medicine, but the path was far from smooth. Her hearing loss created a daily battle. Medical rounds were grueling not only for their intellectual rigor, but for the sheer strain of trying to listen to murmured conversations and instructions. Helen responded by inventing her own diagnostic techniques. She trained her fingers to feel the vibrations of the heart through a patient's chest. She studied the movements of lips and facial expressions to follow discussions. Most remarkably, she developed the ability to interpret heart murmurs and irregularities through touch and visual cues, a talent that would later become legendary. Despite the challenges, she graduated in 1927 and completed her internship and residency at the Harriet Lane Home for Invalid Children, part of Johns Hopkins. There, she was drawn to a disturbing pattern. Infants, seemingly healthy at birth, began turning blue, gasping for air, and dying within months. Doctors called them blue babies. At the time, congenital heart defects were poorly understood, and treatment options were non-existent. Helen didn't look away. She began to document these cases obsessively, recording symptoms, timing, family histories, and outcomes. Using fluoroscopy and painstaking dissection of autopsy specimens, she identified a cluster of cardiac deformities, later known collectively as Tetralogy of Fallot.
Well, it's something that up to now has been written off as untreatable, but I don't believe it has to be. I'm speaking of Tetralogy of Fallot.
Blue babies.
Yes.
This group of defects caused a deadly misrouting of blood within the heart and lungs, depriving infants of oxygen. But Helen didn't stop at observation. She began to wonder, if the problem was too little blood reaching the lungs, could that flow be increased? Could you reroute the circulation in such a way that oxygen-poor blood would have another chance at picking up life-giving oxygen? This was more than a clinical question. It was a paradigm shift. At a time when pediatric heart surgery was virtually unthinkable, she was proposing a radical new approach. She had no formal surgical training. She had no precedent to follow. But what she did have was clarity of vision, a deep empathy for her patients, and an unshakable belief that medicine could do better. Her proposal would eventually change the course of medical history. But first, she would need allies, and those were not always easy to come by. A woman, a deaf woman, a pediatrician proposing heart surgery. In the hierarchy of early 20th century medicine, she was a triple anomaly. And yet, she persisted. Taussig's early life and struggles were not just prelude, they were proof. Proof that greatness often begins not with confidence, but with determination. That the barriers placed before us can sometimes become the very tools we use to climb. That even in silence, a heart can speak volumes. In the next chapter of our story, Helen meets the partners who would help turn her audacious vision into a life-saving reality and perform a surgery that would rewrite the history of pediatric cardiology. The Blue Babies and a Bold Idea. In the stillness of the pediatric ward, Helen Taussig could see the blue tint of death before it spoke. She saw it in the lips of infants whose cries were faint, whose skin turned dusky, whose mothers held them close as if willing their breath into the child's tiny chest. These were the blue babies, infants born with a death sentence written into the chambers of their hearts. The condition was Tetralogy of Fallot, a congenital malformation made of 4 defects that disrupted the flow of blood between heart and lungs. The pulmonary artery was too narrow. The wall between the ventricles had a hole. The result? Oxygen-poor blood was being pumped into the body. These babies were literally suffocating from the inside out. There were no treatments, no surgeries, no hope. Helen Taussig, now head of the Pediatric Cardiac Clinic at Johns Hopkins, refused to accept that verdict. Her obsession with the blue babies became personal. She examined them with all the tools at her disposal: observation, touch, and deep clinical curiosity. She recorded every heartbeat, every symptom, and every variation in their physical condition. She noticed patterns others didn't see. Taussig had a radical idea. If the lungs weren't receiving enough blood, could a new pathway be created? Could blood from another artery be redirected to the lungs, bypassing the defective route? It was revolutionary and dangerous. No one had attempted heart surgery on such young, fragile patients. The very idea was controversial. At the time, pediatric cardiac surgery was so taboo that many surgeons refused to even consider it. But Taussig wasn't a surgeon. She was a thinker. And she knew she needed someone willing to try. That someone was Alfred Blalock. Blalock was the chief of surgery at Johns Hopkins, a man known for both brilliance and innovation. But just as important to this story was the man who worked beside him in the shadows. Vivian Thomas, an African-American lab technician with the hands of a virtuoso and the mind of a scientist, despite having no formal medical degree. Thomas had been Blalock's right hand for years, developing and perfecting surgical techniques on animals, often without credit. Taussig approached Blalock with her idea: reroute a portion of the subclavian artery to the pulmonary artery, thus delivering more blood and more oxygen to the lungs. Blalock was intrigued. He and Thomas began working in the lab. Vivian Thomas, with remarkable precision, practiced the shunt technique on dogs. Dozens of surgeries, countless hours, trial and error, correction and refinement. Eventually, the procedure was ready. On November 29, 1944, the team prepared to operate on a 15-month-old girl named Eileen Saxon. She was cyanotic and frail, unable to walk, her lips and fingertips tinged blue from lack of oxygen. The operating room was tense. Blalock stood over the child. Behind him, just out of view from the public eye, was Vivian Thomas, ready to guide and advise. He had performed the procedure many times in the lab. Blalock, remarkably, never had.
Good, got it now.
Bleeding controlled.
As the surgery began, Thomas provided crucial instruction: the incision, the clamping, the precise point at which the subclavian artery should be sewn to the pulmonary artery. With every heartbeat, the stakes rose. Then, color. Eileen's lips, once blue, began to flush pink. Her extremities warmed. Her oxygen levels climbed. The silence in the room broke into quiet amazement. They had done it. A child's heart had been rerouted and saved. It was the birth of the Blalock-Taussig Shunt. Word of the surgery spread quickly. The press called it a miracle. Desperate parents wrote to Johns Hopkins from around the world. Over the next year, dozens of similar surgeries were performed. Each one represented a crack in the wall of medical impossibility. But while the operation bore both Blalock and Taussig's names, it was Vivian Thomas who had designed and perfected it. His absence from the headlines, and even from the surgical theater's stage, was a reflection of the times. In an America still steeped in racial segregation, the man whose hands had made the miracle possible was confined to the lab. Taussig, to her credit, always acknowledged both men. In lectures and publications, she gave Thomas the praise he deserved. She understood, perhaps more than most, what it meant to be overlooked. A woman, a deaf woman, a non-surgeon in a surgeon's world. She had earned every inch of respect by pushing against systems built to exclude her. And the shunt was only the beginning. Taussig continued to refine her theories, collect data, and advocate for pediatric heart surgery. She helped standardize the operation, trained other physicians, and published extensively. Her work laid the foundation for the field we now call Pediatric Cardiology. But perhaps her greatest contribution was the example she set, that innovation does not always begin with tools, it often begins with questions, that the best medicine listens, not just to symptoms, but to silence, and that even the tiniest heartbeat is worth saving. In the next part of our story, we follow the ripple effects of the Blalock-Taussig Shunt and how Helen Taussig's relentless spirit transformed not just cardiology, but the role of women in medicine, and saved a generation from the shadows of congenital heart disease. The Blalock-Taussig Shunt, Birth of Pediatric Cardiology. In the annals of medical history, few moments shine as brightly or as poignantly as the first successful Blalock-Taussig Shunt. But for Helen Taussig, it was never about glory. It was about breath. It was about children whose lives began in blue and for the first time could turn pink. In the months following that first operation, Johns Hopkins became a pilgrimage site. Parents arrived with infants wrapped in blankets, their tiny chests rising and falling with desperate effort. Taussig met them all, not just as a physician, but as a witness to their anguish. She held their children, examined their hearts, and offered a hope that had not existed before. Each new surgery carried risks. Each success, a miracle. By the end of 1945, more than 24 blue babies had received the shunt. Survival rates climbed. Some children who had been too weak to cry now wailed with healthy lungs. Others took their first steps, their skin no longer shadowed by hypoxia. But while the media heralded the miracle, the medical establishment was slower to embrace it. Some colleagues viewed the surgery as reckless, even unethical. The idea of operating on an infant's heart was considered not just radical, but borderline heretical. The heart, after all, was sacred ground. To tamper with it was to invite catastrophe. Taussig stood firm. She presented her findings at medical conferences, published in academic journals, and trained a new generation of pediatric cardiologists. Her textbook, Congenital Malformations of the Heart, became a definitive resource. Meticulously detailed and richly illustrated, it was both a technical guide and a philosophical statement that these children mattered and that their hearts were worth understanding. And yet, Taussig's work was not without challenges. Despite her central role, she was often overshadowed in public narratives. Blalock, with his surgical theater and institutional power, received the lion's share of recognition. Vivian Thomas, despite being the hands behind the shunt, remained in the background, unnamed in official histories, absent from honors. Taussig knew this injustice. At lectures, she spoke of Thomas's genius. Privately, she lobbied for him to receive credit. And in the quiet solidarity of the marginalized, she saw his brilliance mirrored in her own struggle, the deaf woman and the black technician, reshaping medicine from the margins. The surgery soon found its way beyond Johns Hopkins. Hospitals across the United States began training teams to perform the procedure. The ripple effect was immediate. Pediatric cardiology was no longer theoretical. It was a burgeoning specialty. For the first time, infants with congenital heart disease were being diagnosed, classified, and treated with an eye toward survival. Helen Taussig didn't stop there. She expanded her research, exploring other cardiac anomalies. She pioneered classification systems for defects, collaborated on catheter-based diagnostics, and continued to challenge the notion that congenital heart disease was a hopeless diagnosis. One of her most ambitious efforts was to systematize cardiac malformations. Until then, medical literature had described such conditions haphazardly, with vague terminology and inconsistent diagrams. Taussig introduced a unified language, based on anatomical precision and clinical observation, that would become foundational in pediatric cardiology. Meanwhile, the children whose lives she had helped save were growing. Some attended school, others played sports. Parents wrote letters of gratitude. One little girl, whose heart had once been beyond hope, sent Taussig a crayon drawing of a pink sun. On it, in shaky letters, she'd written, "Thank you for fixing my heart." But while her medical career soared, her personal life remained largely private. Helen Taussig never married and had no children of her own. Some colleagues speculated that her deafness, her single-minded devotion to medicine, or her status as a woman in a man's world had shaped her solitude. But if she felt lonely, she rarely let it show. Her patients, her students, and her mission seemed to fill that space. Taussig also began advocating for systemic change within medicine. She pushed for more inclusive training for women, mentored young female doctors, and campaigned for research funding into pediatric heart disease. Her lectures were not just scientific, they were prophetic. She called for a future where no child would be dismissed as untreatable and no doctor overlooked because of gender, race, or disability. Recognition eventually caught up with her. She received honorary degrees from prestigious universities, became the first woman to be awarded the American Heart Association's highest honor, and in 1965 broke yet another barrier, becoming the first female president of the AHA. But perhaps the most remarkable recognition came not in awards, but in influence. A new generation of pediatric cardiologists cited her work as their foundation. Surgeons developed advanced techniques inspired by the shunt. Medical schools created curricula around her classifications. Hospitals built entire departments based on her model of interdisciplinary care. The Blalock-Taussig Shunt, once experimental, was now standard. And still, Taussig pushed forward. She traveled extensively, lecturing in Europe, Asia, and South America. At every stop, she spoke not just about surgery, but about ethics, empathy, and the responsibility of medicine to evolve. In one particularly moving address in Geneva, she told an audience, "To be a doctor is not to conquer illness, but to stand alongside those who suffer and to believe fiercely that even the smallest patient has a future worth fighting for." That belief would guide her through the rest of her life and into one of the most unexpected chapters of her legacy as a fierce advocate during a looming medical crisis. But that is a story for the next part of our journey. A Heart for Advocacy, Later Life and Medical Legacy. By the late 1950s, Helen Taussig had already altered the course of pediatric medicine. She had trained a generation of doctors, helped birth an entirely new medical specialty, and given thousands of children a second chance at life. But she was not finished. As she moved into the final decades of her life, her attention turned outward, from individual hearts to global ones. She saw herself not just as a clinician, but as a guardian, a protector of the vulnerable. And in 1960, that calling found its most urgent test. The thalidomide crisis was already unfolding in Europe. Marketed as a sedative and treatment for morning sickness, thalidomide had been prescribed to thousands of pregnant women. The consequences were devastating. Infants were born with phocomelia, a condition where limbs were shortened or absent entirely. The drug had passed safety tests in animals, but not in humans. It was, in effect, a mass poisoning. Taussig was horrified. She traveled to Germany and the Netherlands to examine affected children firsthand. She met mothers who had been told the drug was safe. She spoke with doctors who had prescribed it in good faith. And she saw again that medicine without ethics, without accountability, could become a weapon. Returning to the U.S., she launched a one-woman campaign to prevent thalidomide from reaching American shelves. She testified before Congress. She spoke at medical conferences. She wrote articles in both medical journals and popular magazines warning of the consequences. Her voice joined that of another critical figure, Dr. Francis Kelsey at the Food and Drug Administration. Kelsey had already delayed thalidomide's approval, citing insufficient safety data. Together, these two women, a deaf pediatrician and a cautious regulator, stood between a drug and a generation of American children. Their efforts succeeded. Thalidomide was never approved for general use in the U.S., and thousands of birth defects were averted. It was one of the greatest public health victories of the 20th century, and it marked Taussig not only as a scientist, but as a moral force. Her advocacy extended beyond thalidomide. In the 1960s and 70s, she began calling for better regulation of pharmaceuticals, stronger oversight of pediatric drug trials, and more inclusive representation of women in clinical research. She also became a mentor to younger women in medicine. sharing stories not just of discovery, but of resistance. One such story she told often was about her hearing loss, not as a tragedy, but as a sharpened tool. She described how silence had trained her to observe more, to feel more, to compensate in ways that made her a better diagnostician. To Taussig, limitation was never defeat, it was adaptation. In 1965, she broke yet another barrier, becoming the first woman to serve as president of the American Heart Association. She used the platform to promote congenital heart research, international collaboration, and cross-disciplinary education. Her presidency was more than symbolic, it was catalytic. Even in her later years, Taussig continued to practice, teach, and write. Her final publications explored not only new clinical techniques, but also philosophical questions. What is the role of the physician in a changing world? How do we protect the patient when science moves faster than ethics? And what does it mean to heal, truly? Helen Taussig passed away in a car accident in 1986, at the age of 87. She had spent over 6 decades reshaping what medicine could be. She left behind no biological children, but thousands of medical ones, physicians, students, patients, and pioneers who carried her legacy forward. Today, pediatric cardiology is a vibrant, high-tech field. Surgeons perform intricate repairs on hearts no larger than a walnut. Children with once fatal defects grow up to lead full lives. And every time a young doctor takes the pulse of a newborn, they are, whether they know it or not, practicing Taussig's medicine. Helen Taussig's story is one of science, yes, but also of soul. She was proof that compassion is not a soft skill, but a driving force. That the quietest voices can sometimes save the loudest lives. And that in the fragile rhythm of a child's heart, there is an entire world worth protecting. Helen Taussig didn't just save children, she created a new field to save them in. She listened with her hands, saw with her mind, and taught a generation of doctors to follow the pulse of possibility. Her silence gave rise to 1,000 heartbeats, and in each one, she still lives.